present information on a sodium warning label policy for the city of Cleveland and on related health information. Can you approach the table? Especially young Ashley, she blew my phone up about 1,000,000,001 times.
I'm glad you remember that now.
Yeah, you went for a walk with me too in the neighborhood.
I did.
And that was very, very good. How long was it? Have a seat.
Thank you.
What was it, about 2.5 hours?
It was a good day.
Yeah, a good day. A good day is always good, man. A good day. So we're gonna have you guys to, just introduce yourself, and I'll let my colleagues introduce
Yes.
themselves.
So my name is Ashley Hebert. I'm Senior Program Manager for Community and Government Relations with the Center for Black Health and Equity. You can call us the Center. I am our Program Manager, and sometimes I represent the Center on lobbying matters such as this.
All right.
My name is Kayla Holland. I am the Food Nutrition Program Manager at the Center for Black Health and Equity, and I'm very happy to be here with you all.
And you from what city?
So I live in Lafayette, Louisiana.
I'm on my way down there. Got some gigs to do. On
Oh,
the
yeah?
24th. Yeah.
Oh yeah? Which part of Louisiana?
Yeah. I'm gonna hit New Orleans for a while. They got the jazz event down
Jazz
there.
Fest is
Yeah, the
approaching.
Jazz Fest. We'll be down there kicking it.
That'd be nice.
Yeah, it's really cool bands.
I'm from New York.
And you guys have to use the mic. You from New York?
Yes, sir.
Yeah, I like New York too. I go to New Jersey, and then we
thank you,
hit the highway, and we go over to New York. Newark, New Jersey, something like that. So,
Oh, and just for the record, Ashley is a proud Florida A&M University graduate. Did you go to FAM? No?
I went to Louisiana State University.
Oh, she went to LSU.
I'm
Oh,
very proud
LSU
of
with the Bayou.
Yeah.
we'll start with the councilwoman introducing herself.
Councilwoman House. Jones.
Councilman Slife, Ward 17 on the west side.
Councilwoman Rebecca Moore, Ward 12. I split east and west.
East to West, first chair. Councilman.
I'm Chris Harsh. I represent Ward 13. It's Old Brooklyn.
Councilwoman Gray, I'm on the east side of Ward 4. That is Woodland, Mount Pleasant, Cleveland Shaker, and Gisman.
Councilman Richard Starr, representing Ward 5, representing neighborhoods of Midtown, Carnegie, Prospect, Central, Kinsman, parts of downtown, and North Broadway.
I also wanted to point out that we do have some support here at the meeting and a few people that would like to speak in support as well. We greatly appreciate their time today, too.
Can you bring them up?
Of course. Come on up.
And Ashley, how far away are you from New Orleans?
I'm 2 hours away. Quick
I'm
little-
like, yeah,
quick little ride.
I'll call you when before
Perfect.
me and the missus when we head out.
Show
there.
you around a little bit.
All right. Yeah. I gotta get shown around, not just the tourist stuff. So, I'll yield to you.
All right.
All right.
Well, let me speak into the mic. My apologies. As you already heard, my name is Kayla Holland. I'm a nutritionist at the center, and this is Ashley Hebert. We are very happy to join you all this morning, and I want to start off by sharing a little bit of background on the Center for Black Health and Equity. So the Center for Black Health and Equity, also known as the Center, is a national nonprofit that engages with healthcare organizations, public health officials, faith leaders, and African American communities in health promotion and disease prevention work. And our mission is to facilitate services and programs that benefit minority communities and people of African descent. We do this by building community capacity, developing community infrastructure, and advocating for equity-centered policies. And we are committed to addressing the social and economic injustices that have marginalized communities and led to deep health disparities. We apply a proven framework for policy and social change to our work in tobacco control, COVID-19, women's health, HIV and AIDS, mental health, and other disparities, including food and nutrition security. So a little bit about the Cut the Salt, Keep the Flavor Coalition. The center is very proud to have spearheaded this coalition for over 3 years, and we are committed to furthering a healthy Cleveland. The coalition is comprised of multicultural, intergenerational Clevelanders who support a sodium warning label policy because the need for a healthy Cleveland, as you know, is not exclusive to one race or one age group. And the objective of a sodium warning label policy in Cleveland is to provide residents with necessary information to make informed decisions regarding their health. And by having access to this information, Clevelanders will be able to effectively manage their sodium intake and reduce their risk of stroke, high blood pressure, kidney disease, and other complications associated with too much salt intake. So, as many of you already know, a community health needs assessment, also known as a CHA or CHNA, is a state or local health needs assessment that identifies key health needs and issues through systematic and comprehensive data collection and analysis. And these assessments give organizations comprehensive information about communities' current health status, needs, and issues. So for the room, we know you all are experts, but we just wanted to highlight that the sodium warning label policy is an evidence-based intervention that is correlated with the findings from the health needs assessment. And some of the findings that were elevated as priorities, they're highlighted on this slide, and they're listed in alphabetical order and included for prioritization based on the findings of all forms of data collected for the Cuyahoga County 2022 Community Health Needs Assessment. And a sodium warning label policy aligns with this evidence-based research because it will definitely increase access to healthy food. As you may know, the access to healthy food is one of those significant needs. Okay, so high level, why this is important in the context of excessive sodium intake. As you all know, sodium is referred to as a silent killer, and this is because it's too often comes up without warning signs, without symptoms, and it's a leading risk factor for cardiovascular diseases like heart attack and stroke, which I mentioned earlier, and studies show that excess sodium intake is higher in restaurant foods, and restaurant foods tend to have more sodium than foods prepared at home. We want to emphasize that sodium labels are necessary to reduce healthcare costs as well as improve health outcomes. And the current dietary guidelines for Americans recommend a maximum of 2,300 milligrams, and an ideal recommendation is 1,500 milligrams per day for most adults. According to the CDC, nearly 500,000 deaths each year are related to high blood pressure. Therefore, reducing sodium intake could prevent thousands of deaths annually. Now that we talked a little bit about the center, the Cut the Salt, Keep the Flavor Coalition, and sodium, I'm going to pass it to Ashley to talk a little bit more about the policy itself.
So the policy would require a warning label, and it has two parts. You have the small icon that's next to the menu item that indicates the sodium content is high, and then a written statement as well, somewhere on the menu, sodium content higher than daily recommended, and I have some examples here. So at the top there, we have the statement, and you can see the menu on the lower right there with the sodium warning triangle icon, excuse me, and then you can see another example on the left. They've done the icon and the words sodium warning.
Where is this at?
So these are just pictures from Philadelphia and New York that have passed this. I'll pause for any questions on that. No questions?
No questions.
Are there limits on the types of restaurants?
Yes,
Yeah.
and I'll get into that just a second. So why is it important? This is giving information that diners do want. Most people do want to want a healthier option when they are eating out, and this is educating our diners about the high levels in sodium and help them choose. When given an option, most people will generally go with the healthier option. So New York City was the first to pass this policy in 2015, first in the nation, and they required chain restaurants to post the warning icon next to menu items that contained at least 2,300 milligrams of sodium, and it applied to all food service establishments that normally would require a health department permit, and are part of a chain, and violators received a $200 fine. Secondly, we have Philadelphia passed this in 2018. It went to effect in 2019. They also required fast food chains to post either a red or black sodium warning label, alongside menu items of 2,300. or more. They also created a website and did an advertising campaign to help the public and restaurant owners. They have a staff person devoted to answering questions via email. Restaurants are permitted to send their menu or send recipes for feedback as well. And they also provide signage. It's a really, really great, easy website that can definitely be duplicated. So what makes the Cleveland policy that we are presenting most unique is that we've expanded this definition, and we've done so to be as equitable as possible. The center works to center equity in all policies that we promote. If you look around Cleveland, you don't see so many chain restaurants. We see Clevelanders getting their meals at delis, locally owned restaurants, gas stations, those types of food service establishments. So we've expanded this definition to include that, to meet Clevelanders where they're getting their meals. We've also lowered the sodium threshold up to 1,500 milligrams because this is the new ideal daily limit of sodium per the American Heart Association. Science has been updated since these policies have started to roll out, and we want to use the best science, the most evidence-based approach as well. So the prevalence of high blood pressure among Black Americans in the U.S. is the highest in the world. It's about 55% of Black Americans have high blood pressure, also known as hypertension. Historical and systemic factors do play a role in these statistics. Among them are adverse social determinants of health. These are the conditions that we live and die. Your zip code quite literally determines your life expectancy due to social determinants of health. And those determinants include lack of access to care, lack of access to healthy foods, and other societal issues that plague minority communities. The good news is that Black people in Cleveland can improve their odds of preventing and beating these diseases by paying attention to what we eat. And this is a very evidence-based approach to help people along for making healthier choices. You guys may have received some emails and some calls and maybe some tweets doing some action alerts. We greatly appreciate your support. Can I introduce Chef Sherelle here for a few words? It's Chef Sherelle Boyd. I'll let her take it away.
Where I know you from?
Oh, cooking in the Glenville community. One of the many communities that I work with to just make our communities, our children, our communities, and the family dynamic just a little bit healthier. So I've been cooking for quite some time. As in the military, went to Johnson & Wales Culinary Arts School, and currently work with a more senior population at the St. Joseph's Convent. So what I found is that a lot of ingredients that are already prepared for convenience or for bulk purposes of feeding a lot of people, sort of a chain restaurant. Whereas a family, more inspired restaurant or deli could be using it for the convenience factor. However, both contain a tremendous amount of sodium. And layering that with other ingredients and components that might make up one dish, you could very well see 3 to 4 times the sodium amount in that entree, in that side dish. So I believe that this initiative will allow the consumer to be more responsible for their health, as well as allowing the proprietor, the vendor, to be a little bit more conscious about the product that they are selling in the community, and to bring awareness to people on both ends.
Thank you, Chef Sherelle. Ms. Julie Johnson, take it away.
Hi, good morning, Mr. Chair and members of City Council. It's a pleasure to be in front of you this morning to address the critical issue of excess amounts of sodium available to our community and the foods that they're consuming. My name is Julie Johnson. Several of you know me. I've worked probably more significantly with Some of you based upon what wards you represent because of food insecurity in the Cleveland area. But for those of you who might not be as well acquainted with Hunger Network, we have 72 hunger centers. They're hot meal sites and pantries all throughout the greater Cleveland area. We also provide essential food and hygiene items to neighbors in need, those specifically who fall 200% or below the poverty level. These are the folks in our community that fall the most victim to the high levels of sodium because they're not only, unfortunately, receiving shelf-stable food at our pantries, which we're trying to change that, but they also have high incidences of eating in our local restaurants, and the food that is less expensive has higher amounts of sodium, sugar, cholesterol, all those things we're trying to avoid, and obviously impact our social determinants of health. We also have a food rescue program. Our food rescue program focuses on recovering edible but unsellable food, including fresh produce that would otherwise go to waste. And we deliver this food within 5 to 7 miles, under an hour, to our neighbors in need. However, due to the increased rate of food insecurity in our community, we find ourselves rescuing more and more prepared foods from other sources, not just produce, as we were picking up from Sanson, but now we're actually rescuing from Get-Go's and things like that. So they're prepared foods, again, processed with high levels of fat, sodium, things that are not good for us. I know that several of you attended our ribbon cutting when we opened up Midtown Market in 2022. And one of the things, as you recall, that we wanted to do was be very intentional about providing our customers with the knowledge of what types of foods they were consuming. So we opened this full choice pantry, and we are in Ward 7 on the border of Ward 5, two of the highest food insecure wards in our city, followed by probably Ward 4 and Ward 13, according to the Center for Community Solutions and the work that they've done within our community. And so we know that there are elevated levels of chronic health conditions for these folks. We decided at Midtown Market if we could prevent some of this, and I'm a huge advocate of prevention from one of my former jobs, we could really help our customers there. So we made a commitment to implement a system called SWAP, or Supporting Wellness at Pantries. And what we do at Midtown Market is we label our foods on a nutrition ranking system. It's just like a red light. It's red, yellow, green. So foods that are red, you want to eat the lowest amounts because they have the highest amounts of sodium, sugar, and cholesterol in them. They're the least healthy foods for you. Yellow is moderate consumption, and of course green would be our fresh fruits and produce that we're really trying to get out to this community who has huge accessible issues to getting to these fresh fruits and vegetables due to just the way our community is set up. And obviously some historic practices that we know have gone on here in the communities that's prevented those folks from accessing the food that they want. I will say that we do have a lot of mom and pop or local restaurants here in Cleveland, but again, a study was conducted back in 2019 that shows we have a high saturation. At that time, we had 1,889 customers for each restaurant that we had, each fast food restaurant. Subway, who says eat fresh, so we talk about going there and getting sandwiches because of the vegetables are on them, actually has some of the highest sodium concentration levels, higher than some McDonald's products, if you would believe that. So the average Subway sub ranges between 1,200 and 1,500 milligrams of sodium in that sandwich, and that is the maximum amount or more than the maximum amount of sodium that you're supposed to intake in your daily consumption. Compare that to a McDonald's hamburger that has 480 milligrams of sodium. So sometimes advertising is not always our best friend when we're considering our food choice options. So today I come before you to urge the Health Committee to consider the implementation of sodium warning levels on restaurants, on their menus, and all of the foods, because it's up to us to make sure that our customers, our neighbors here in Cleveland, are making the most healthy, informed decisions that they can possibly make in our community. We remain committed as Hunger Network to health, nutrition, and the well-being of our neighbors. And we ask that this ordinance get some sincere consideration to help us with our fight to create a healthier Cleveland. I'm open to any questions that you have or comments that you would like to share, please.
Beautifully said.
Do you, did you have a relationship with Dana Iribarren?
Dana Iribarren was my predecessor. She's deceased. There was one director in between us. Her husband, Alex Iribarren, sits on our board of directors.
How's he doing?
He's doing well. He's actually down in Chile. He has a slight absence, leave of absence on our board. He has a home on the coast, and he's down there doing a little bit of remodeling, so.
I have an article I'm going to share with you with Dana Iribarren and I back in 1989. You guys helped pioneer Harvest for Hunger.
Yes, we did.
And back there, matter of fact, it was me on the committee, a few other people, and I have the article upstairs. And when I hear that's why I looked at you and smiled. That goes way back. And we were doing the Harvest for Hunger. It was every March and September. That's what Dana wanted us to do it, every March and September. And then we started doing it later, every year on an annual basis, Harvest for Hunger. So I have the article upstairs. I want to share it with you.
Yes.
And Dana, that was my buddy, man, my friend.
She was an amazing woman. I wish I had had the opportunity to meet her. It's funny, our paths crossed on several occasions. I used to actually work for Substance Abuse Initiative of Greater Cleveland, which was housed in the Rockefeller Building. Somehow we never managed to run into each other, even though Hunger Network was in the same building for years and years. And now, you know, we're located in Midtown on Euclid Avenue between 40th and 46th Street. So, but I would love to see that article because I'd like to. We've been around for 50 years. We've been a nonprofit for almost 30. We would love to try to gather up that rich history, some of it which has gotten lost over the course of years. So I would appreciate
That's why I looked at you
that.
and smiled. You guys were not around at all. You were not around, of course. Of course, Star wasn't around. We were doing it. So it's history with Harvest.
Yes.
So when I see Harvest for Hunger, people walk up to me and tell me about it. And I just look at
Harvest
them
for
and smile.
Hunger isn't ours anymore.
We're the pace setters, man. Definitely. I'm going to say this, and then I'll open up for questions. Even the reason I was here late today, because I thought I can get a few minutes in to do the Richard Star, which I call it.
The Richard Star.
Yeah,
The
I was
workout
at-
plan.
Yep, I was at Planet Fitness. You know, I'm always walking and working out. I
Yep.
was at Planet Fitness, lifting some weights and running. Those kind of things help me out to keep my blood pressure in check. I don't put salt on my food, except I put some on a little bit today for grits, you know. And but other than that, I don't. And for 22 years, I didn't eat meat. For 22 years, but that processed food. But you were my chef also. See, that's how old I am. I can go back to a lot of them. And you were working with us, with the wife and I at Glenville.
Yes.
And then which is okay, you end up going over to Frederick Douglass.
Yes, Frederick Douglass and Stella Walsh, as well as I'll be in the Collinwood Recreation Center this summer, teaching healthy cooking classes.
She's a good cook. To the council members, you should request for Sherelle. I know, because when she cooks, she tells people the reason why. And, you know, you are what you eat, drink, and smoke. And, which I don't smoke, but you need someone to tell you how this is going to benefit you and to help you and the whole 9 yards. And they end up stealing it from me. And when I first brought you in, because you were at Glenville,
Yes.
they said, Councilman, look around.
Yes, yes,
Councilman
yes.
Frederick Douglass. I'm like, I was upset for a second, and I said, well, it's benefiting people, and it's a good thing, just like with, you know, Harvest for Hunger and all of that. So I looked at all you guys and smiled, and I remember that. But I ended up last year with high blood pressure. I don't use salt, except when I told you I put it on grits. I don't, and even when I go out to eat, I cut my food in half, and I work out all the time, all the time. Me and Richard Starr call him 4 or 5 o'clock in the morning, and I'm headed to the gym. You know right, Richard? We there working out at the gym. That's important for me, is to be healthy, and I still ended up with high blood pressure. I still ended up with it, you know. But when I work out, it drops. Go bloop.
Yeah.
It drops way down, you know. And same thing with cancer. I ended up with cancer. Didn't eat meat for 22 years. Work out, you know, you walk with me. And I walk sometime for 2.5 to 3 hours, and still ended up with freaking cancer. Still ended up with. Sometime, you know, I know that. Like this guy here is activist, Chris Harsh. Sometimes, young Chris, you take it to heart being a councilman, and we're close to everyone, and you get all that pressure. People don't know. They see council members, and they think that we're living a good life, or whatever the case may be. But we get a lot of emails, and we receive a lot of phone calls. So there's one issue after another, after another, after another. And we are the closest to the people, and you can feel it in there, and you feel that pressure and the pain of infant mortality or drive-by shootings or going to funerals. A lot of time, and especially when you mention Huff and Glenville and Fairfax, we don't have a lot of human capital in our communities. So they reach out to the council member, Starr, or council member Jones, and council member Conwell, and you feel that pressure, your blood pressure goes up. Your blood pressure goes up.
Truly.
Because you hear it all the time. You can go into a store, I'm not complaining, I'm just being real, to get a loaf of bread. It might take you, Council Lady Jones, 2, sometimes 3 hours to get out that store because you're hosting a community meeting right there in the middle of the store
Right.
for everything.
I always say local leads the way, so it stays with you. And I'm a heart trauma survivor, so I truly understand the health benefits of just having more information. And you're right, my heart trauma happened during a Louisiana legislative session. So
Yeah, you did tell me that when we were walking.
It's
You told me,
extremely
yeah.
stressful. So I do understand, and we appreciate your dedication to public health.
Prevention is the key. You have to watch diet, but some kind of way that we have systems in place to monitor and control. Because it can sneak up, even if your diet, like I told you, my diet is, I think it's good, and I work out all the time. You got to be able to monitor it.
Yeah.
And here's the piece, is that comfort food also. How do you move away from comfort food, thinking about your auntie and your loved ones that they taught you
Right.
for a while about certain foods? How do you control that?
And that's why it was so important to have Chef Sherelle here, because a lot of recipes can be reformulated with lower sodium items, and especially the added sodium as well. So we wanted to make that known that a reformulation, they may avoid having to put a sodium warning icon once that is retabulated as well. And that's why it was so important to have Chef Terrell here to drive home that point as well.
You know, Chef, and I yield to you, when this country was founded, the pioneers would go out to find salt mines to preserve the meats and to preserve food, and you need salt also for your, I think it's for, what is this? Your thyroid.
Thyroid, yes.
That's for the thyroid. So you got to be able to control that. But they put salt in the food. And before FDA came to regulate more things, even in the 19th century, food would go bad. And the restaurant people and the wholesale people put salt in food to preserve it.
So that is a great point to be made of a benefit of salt. However, salt in its excess, like anything else in excess, is more of a detriment to it as or in health. So Whole Foods, more back in the day, salt used as a preservative because it takes out the moisture of our product and helps to preserve it. So think of the salt that was put on meat or salmon to cure or to preserve is going into our bodies and is still depleting moisture from our bodies. So that is one of the reasons why salt is a detriment in excess. I do find that salt in a lot of kitchens and areas that might not be as more well-versed on how to use salt, misuse salt. I do have, shameless plug, a salt-free seasoning line that is sold in the Fairfax market called The Right Spice, and it does not contain any salt. I bring the flavor and I let you add the salt that you might need. Salt, to me, should be used as a magnet. Hold it over your food, your stew, your chili, your entrees, and it's just to gather all of the flavor together. It's never to been used as a flavor mechanism, preserving, curing, drying out. But it also can be used just to accent the already flavors that are already in a dish. So whereas my grandmother's macaroni cheese doesn't really need salt when I'm using cheese, maybe I'm adding a little bit of Parmesan cheese with my cheddar cheese, and I'm biting off the flavor that's on that Parmesan cheese, and I don't really need the salt at the end. So it's just being a little bit more responsible and to think a little bit more intentionally when the local deli is making a Polish boy. You know, what can we switch out the barbecue sauce to make it a little bit more healthy?
Can I yield to my vice chair? She have to run real quick to do, I guess, an event or something.
Yes, I apologize. It's actually to help get my rec center to have better equipment. This was the only better workout equipment. So it's in the same vein, but I do apologize for having to leave a little early. I'll also say this issue is close to my heart. I remember when my dad was diagnosed with diabetes, and all of a sudden we had to have the potassium salt at my house. And I was younger, and I didn't like it that much, but we started cooking with it, and I got more used to it. So ever since then, you know, we kept an eye out for it. I really appreciate you guys coming in, especially coming in from out of town to talk about this issue. I will say, just to my colleagues, I do have a little bit of concern about moving away from the chain restaurant model and asking our mom and pops to redo their menus, put in this warning, even like the test to know how much sodium is in a particular dish seems like it might be a high lift. I think about some of my restaurant owners that I love and support in my ward who this might be a significant burden for them. And in general, I am a big believer in I don't know, I guess like the individual right to sort of choose what you eat. And obviously this goes to the question of more information about that. But I don't ever want to get into a position where we're shaming people over choices, and especially because food is so close to culture and heritage. I'm a little bit hesitant about it, I'll be honest. But I understand why this is such a critical issue. And I'll just, before I leave, I'll note that for my colleagues that I do have some concerns, but really appreciate you coming out.
Thank you so much.
Thank you.
And I do appreciate your concerns. That's why, it is the will of the committee to allow for an appropriate implementation time. Definitely 6 months, 8 months, maybe even a year. You see, Philadelphia did a year of implementation to give restaurant owners this time. Definitely want to respect business owners as well as culture. In meetings that we've had with the Cleveland Department of Public Health, they're very much on board with assisting in the tabulation of sodium, educating restaurant owners on how to read nutrition labels, because I do agree that it's going to have to be a tabulation either by hand or with an app to help them tabulate what the amount of sodium is in their recipes now. So we definitely want to meet business owners in the middle by giving them ample time to reprint menus and understand why their recipe would now need a sodium warning label.
Emphasizing the education and assistance. Of course.
Council Lady.
Thank you. So
and we'll talk about it later.
Yeah, so this is the thing too. Last week I was in Birmingham on my fellowship, and one of the stops we made was to the Legacy Museum in Montgomery. And even the things that we see, and sometimes as people, culture may not necessarily be your culture, may have been just because of how systems have been set up.
Yes, ma'am.
That's true.
So, and the things that a lot of times have been not healthy for us, because that has been, and I'm talking specifically from African American experiences, the things and the foods that we eat, and not necessarily has been maybe necessarily what we wanted, but that was the only thing that we have been able to eat. Hence, therefore, going through society, that's what people cater to, because again, you're now 5 generations in, and that's what you've been acquired to, because that's the only thing you could eat. Right. You see what I'm saying? So I really, this is a very very nuanced conversation about when you talk about culture, and I think there's a responsibility that we need to look at when it comes to communities that, again, living in a community like the Huff community. When you look at life expectancy, you know, having one of the largest life expectancies between here and another community within Cuyahoga County, which is significant. I think it's like 20 years or so, right? 20 years life expectancy rate of something that's still here in Cuyahoga County. And this is one element of a multitude of things where it can't just be what people are choosing to. People are not just choosing to have an early death.
Exactly.
There are systems in place, that make that shorter lifetime expectancy to be that reality. And so, yeah, I get that. That probably could be like even just a mapping exercise, just to do the life expectancy, to look at what are the food sources in the one community versus the one that's in the Huff neighborhood.
Yes.
I'm going to challenge this committee, and not even that, I'm going to challenge myself. I'm going to bring it to this committee to see what are the options that you even have to eat. That goes into what you consume. If you don't have the options, if you don't have things, you only going to eat what's in front of you. And so how can you be knowledgeable or make an informed decision on what you eat when eat is so necessary for your life, when you don't have the option for anything else? If all you have is gas stations and corner stores to eat from, and you got to eat, that's where you're going to eat from. Right. You see what I'm saying? So I think there is a responsibility specifically for us in government to right the ships wrong, because again, it is because of policies that many of our communities are in these circumstances. I love business, I appreciate it, but again, we got to understand what government's role is. Government has created many of these issues. So again, government absolutely has a more responsibility to right the ships when we know there are people in our city whose lives are being cut short because of the lack of knowledge, what they don't have, because of the lack of opportunities of things that they cannot get. It absolutely is our responsibility. And I am not trying to, I want people to be able to, small businesses to do well, but I will always challenge for the people who are the business owners, where do they live? I would also bring that for every business owner who was saying, I can't afford this, I can't afford this. I would also like you to bring to the table, tell me what zip code you live in. Show me what resources you have in your community versus those that are in the community that I serve. Then we can have a real conversation. No, we're going to add to the conversation. But again, I'm telling you, I'm some type of way. I am so grateful to the Ashe Fellow, the fellowship that I am in, and just some of the experiences and the conversations that I have been afforded, and just the network that I am in. It is having me I'm just in a place of a renewed spirit. I am relaxed, refreshed, and definitely going to be committed to doing what I can to using the opportunity and the blessing that I have to be here in the seat in City Hall, to utilize government to do much better for our people. because it has been government that has created the disparities and the inequities in our community. Government.
That's right.
This government, as well as many others, but I'm right here, so this is where I'm gonna do my work right here. So I thank you all and looking forward to this conversation.
Thank you.
I agree with you 100%.
I'm on my way the other day
Lady,
to Birmingham.
you definitely right.
I'm doing my job.
Chef Sherelle, what I'm going to
Yes.
do also, I think I still have your phone number. This summer, I'm going to take a few courses or lessons from you. I'll tell the wife I saw you today, and
Oh, please
we'll
do.
work on some dishes I want to, to do.
Yes, so I think either Frederick Douglass, Collinwood.
And I ain't going way out there. I'll just pay you.
Okay. Well, Glenville is always my first love. So,
Right,
you know,
you
I'm
come from Glenville.
I'm on the market still on the weekends.
You're
on the
you're
105 at the Gateway Market, trying to get more people to come out. So yeah.
Right, you just tell me, you say, Kev, this is what you need, and then we'll hook that up.
Okay.
So I can learn more dishes and those kind of things.
I'll email you. Yes.
Cool beans. All
I
right,
will.
Don't. Councilman Starr, she said she'll email me. Well,
Should I call him?
You gotta call
Text him.
me.
Okay, I'll call and text. Text and call. And I'll tell Serena. I do.
Or text, right?
I do. I will.
I know, he calls me. Everybody calls me.
Okay, I
Say,
will.
Kev, so-and-so, I said, I got you. You
But
email
then,
me,
yes.
the emails flood in.
Yes.
You know.
Well, it's important because once again, Councilman, what you adhere to is just a learned practice.
Right.
So we just have to, go back to what we ate as a community is all geographical. We usually what's accessible and what grows well or what didn't grow well.
That's what the First Lady
We
just
never
said.
really ate, and we just have to go back to a traditional method of eating, but being a bit more responsible with what salt is really for.
That's right.
It's not because we have to move away from because it's a product that's going to allow things to be more shelf stable. And all the preservatives that are in that jar of barbecue sauce or that ranch dressing, the sodium is also to make it not go rancid on the shelf. So whereas maybe changing it out, making it smaller portions is also a way to be able to give the give the consumers the product that they need, but just not so much of it because of the sodium content.
Yeah, that comes with education.
Yes, it does.
You could take your medication, work out, and then wonder why blood pressure is still high. It's from what you just narrated, the ketchup or the barbecue sauce or the mayonnaise, have the sodium in it.
Yes.
So your blood pressure is going high. And you wondering what's going on with this? I just ate. It's because of those reasons that you just narrated.
And from a purveyor, they can cut back on the portions instead of getting a 2-ounce ramekin of extra barbecue sauce. Maybe it's cut down to a half an ounce now. So at least you're doing a just due to the client, the customer. I'm gonna give you this much ranch instead of the 2-ounce serving that I usually give you.
I'm going to yield to Chris Harsh in a second, Councilmember Chris Harsh. But here's the with your argument, the food industry. Sorry, Council Lady, but you're like a state rep right now. They're going to reach out to the state reps and the state senators if you want to try to regulate it in Cleveland. And what they will do is it's a cash game. And the common people don't have money to give to state representatives or state senators. So let's say we pass a law. They'll reach out to the state, just like they did with the cigarettes, which I told Monica they was going to do it, and they did it. They'll reach out. They did me like that with trans fats. I pushed trans fats to ban trans fats. They reached out to the state representatives and not the council members, because it's the state legislators, state senators. So you got to be ready and able to fight this battle even downstate. Just like even with gun control. You talk about gun control, NRA is down there and they give money to the state representatives, although the council members were blamed for everything, but they give the dollars to the lobbyists down state. So what you're trying to push, they'll go down state and beat you.
Flat
Sorry,
out.
but you know.
Yeah, I'm just saying that for that, even with that, that does not mean we don't do it.
No,
Right?
yeah.
You
Still
know,
push
we still have to push for it, and we have to fight for our people because, again, we, are invested. And I also, just as we talk about education, be very clear, like, people need to have access. If the system was actually set up for people to be healthy, then people would be healthy. The system has been set up for people not to be healthy, and we cannot overburden people with their responsibility. Well, you need to be educated and you need to be know these things. If you had the knowledge and the information, we wouldn't be in this situation. Or if you wouldn't, if it was set up for people to get just the things that they needed in a healthy and restorative way, we wouldn't be in this position, right? So a lot of things we are trying to correct, redirect, and move in different directions. And so while I appreciate education, I also feel like accessibility and just creating the setup for people to be properly informed and have access to the things that they need to live healthy and well lives is the responsibility, especially more so on our government systems that created these systems of inequities and uneducation or miseducation. It's because a lot of times people are not educated and need to be re-educated for something because we have created the system for them not to know.
Yep.
So.
But you know what, Council Lady, then I'm gonna yield to Councilmember Chris Harsh. We can open up our newsletters, we can open up several channels. We have Ashley to write and her group to write about issues and concerns with SALT. I can have you come speak to my residents. I can create a forum that you could talk and work with David Malagill, the Director of Health, so we can start educating people because it's through the people.
Yes.
And then we could do it that way and we
Yes.
can help you out and not create barriers, but we educate.
Yes.
All right? Councilmember Harsh.
Of course.
Thank you. Mr. Chairman, I'm just thinking about a couple of things. First off, it's always been interesting to me that throughout human history, poverty and famine have been pretty closely associated. It's been a problem throughout the world. But in America, we have poverty and obesity, and these things have become, ubiquitous, right? We associate these two things. And as my colleague, the council lady, was just saying, it's because the choices that have been set up for people are very restrictive, and you don't have a lot of options. And I think there's also something that we should acknowledge, just the psychology of poverty. If you're broke and you're stressed and your life is not looking up, then the bag of chippies might be the one highlight in your day, right? It might be that corner store. You know that the hot fries are going to be good. You've had them before, and you know that it's something you can look forward to. And that expectation that sort of like is built into the psychology of low-income communities is really affecting Americans across the country. I remember Jamie Oliver did this TV show a couple of years ago where we went to the city in America, the region in America that had the highest obesity rates, and it was in West Virginia. It was an almost exclusively white community. And he went down there with an attempt to try to see if he could make this a healthy community, and he started with the schools and the institutional obstacles that got in his way. Have you all seen, you know what I'm talking about? The institutional obstacles that got in his way. He went into the school system and said, I'm a chef. He was pretty popular back then.
Yes.
Okay. I can make healthier food than what you're giving your kids, and you have the highest obesity rate in America with these young people. And the institutional obstacles were tremendous. The school was like, nah, we gotta every meal has to hit every single benchmark. It's gotta have a certain amount of fiber, a certain amount of vitamin this, vitamin that. And if you can't squeeze all that into one meal, we can't serve it by law.
Yes.
And this was revelatory. But the other problem was he couldn't get the kids to eat it. Right. He was making fresh coleslaw and good food that I think most people like, right? But the kids were like, nah, I'm gonna go with the nugget. He actually processed a chicken nugget in front of them. Took the chicken, put it through the grinder, disgusting as it was, threw in the lips and the, all the stuff, right? And came out and showed them a chicken nugget or a fresh cut breast of chicken, and they were like, give me the nugget.
Right.
Right? And my family does not come from a long heritage of people that eat chicken nuggets, right? But my kids love this stuff, right? There nobody My grandparents probably never had a nugget in their life, right? This is like a new food, right? This is not, you know, cultural heritage, right? Nobody in my family passed down the nugget recipe. But my kids love this stuff, right? And it's what's put in front of us. It's what we're given access to. And I'm kind of just rambling because I want to get to this point, which is people make choices based on the options in front of them, like the councilwoman is saying, right? And I understand what we're trying to do here is give people more information to make healthier choices. I do have this lingering fear, though, that there's this other massive education component that goes into it, because when we're dealing with the stress and the depression of poverty, and people just want to feel good, they just want to eat something that makes them happy, right? And my question through the chair, congratulations on your promotion, Mr. Chair. You're rising fast around here. Is in New York and in Philadelphia, where this has been done, I think, for almost 10 years, you said, 2015 in New York. Has anyone gone to these restaurants and asked them for the actual data on their sales? You know, like which dishes sold at which rates before this and which dishes sold at which rates after this, to try to get some of that just sort of statistical data about the impact of something like this on consumer behavior?
So that is information that we can provide to you. Granted, this is an evidence-based approach, but we do understand that this is not the answer to everything. This is one tool in the toolbox for a healthier Cleveland. So, you know, there's still so much work to do, and let's take this healthy first step. But we're happy to provide you with that information in New York and Philly as well. We can definitely dig that up.
I would love to see that, because I always, you know, I kind of blow past the calorie count. I don't eat out a lot. I mostly eat at home, which I think is probably the healthiest thing you can do, really, is prepare your food at home. I mostly eat at home. My wife's a wonderful cook. I'm lucky in that respect. But when I go out to eat, I'm not even looking anymore. Right? I'm once a week, maybe, I go out to eat or eat outside the house, and I'm not worried about it on that day. I suppose if I ate out all the time, it would be a bigger issue. But I'd really love to see that, because I'm curious what these restaurants report their sales to be. Like, what was the triple hog dairy sales before the sodium sign, and what were the triple hog dairy sales after the sign? I'm looking at your slide. That would be really cool. Go ahead. Then I have one more.
Yeah, like Ashley said, we'd be happy to provide that information. And I do want to also just emphasize that the name for our coalition was intentional in terms of our goal to increase awareness that you can still keep the flavor when you're cutting the salt, right?
Yeah.
So I think the populations that we need to keep in mind when we're talking about the need for education, the need for, pivoting and redirecting things with the interest of creating a healthier Cleveland, is we need to also remember that there's people in our communities that are suffering from not just heart disease, but maybe chronic migraines. Maybe they're the benefit of seeing that information, even though we might breeze past the nutrition facts, it might help them to make healthier choices that impact their lifespan, that impact their short-term quality of life. And it's our responsibility, like Councilwoman said, to make sure that we are doing everything we can. And as Ashley mentioned, this is one of the tools, the evidence-based interventions that are aligned with the community health needs assessment for this area.
Okay. My other question through the chair is just about your work here in Ohio. So I'm assuming that you're a national organization in New Orleans and in New York. So through the chair to our guests, where else in Ohio are you approaching legislative bodies? Where else in Cuyahoga County are you approaching legislative bodies? And have you talked to our county body as well?
So I have had some conversations at the county level. We just felt that it was a better approach, local leads the way, to start with the city of Cleveland because of the other really great public health policies that have been passed here, the Healthy Restaurant Kids Meal Beverages as well. So we continue to have evolving conversations with the county level lawmakers, but we came here because we felt that it was best suited at the city level.
And I appreciate you visiting Cleveland. Hope you enjoy your stay. We always have this conversation whenever these come up, though. It's always an issue of, are we hurting our local businesses? Are we making it easier to do business outside the city? Or are we making it easier to just, Cleveland is ringed by suburbs where you can literally cross the street and not be in Cleveland anymore.
Yes.
And you can set up your business on the other side of the street. And in my neighborhood, Brook Park, I got one side and Parma's got the other, and you can decide which side of the street to set your business up on. So I understand the philosophy of what you're thinking and what you're saying, and I'm not trying to, throw wrenches at it, but the county covers more municipalities, and it's much harder to locate outside the county than it is to locate outside the city. So it's just something worth considering. But all in all, I think that we have a health epidemic in America. We are rapidly becoming less and less healthy. I think I've even heard the military say things like there's like a very limited percentage of people in high school that are actually physically capable of going into the military and passing boot camp.
Wow.
I've heard of it as like a national security issue. Like we have a health problem in America, and it's everything, right? It's the salt, it's the saturated fats, it's the poly whatevers, it's the deep frying everything, it's the smoking, right? It's the excess of alcohol. We have a lot of problems with our health, and I see that you're trying to address this in this category, and I appreciate your efforts, and we do need to work on this issue. So I'll stop rambling and hand it back over to the chair. So thank you for coming.
Thank you.
Thank you, Councilman Chris Harsh, for your remarks. I do see on the list, I was next, but I do see my colleague, Councilwoman Gray, so I will pass it over to her, and then I will probably help close us out.
Okay, thank you. Co-chair or chair?
Co-chair?
Okay, co.
Vice
Thank you. He is my colleague, a fantastic guy. Thank you, colleague. So I want to thank you for coming. I welcome you guys here today. I do agree with my colleagues who made their assessment on about the history of salt containment, of how certain geographical areas deal with their eating certain type of foods. However, I just want to put a plug in. Between 2009 and 2019, I was part of an organization that's in the footprint of Ward 4 and Ward 6. Our group, and the group still is, in effect, Neighborhood Up. We actually created a program called Healthy Eating and Active Living. We co-partnered with Metro Hospital and Case Western Reserve that actually did the geographical data on how our community in that footprint ate foods. So we actually went out for a few years and did the footprint in our Buckeye Shaker Woodhill neighborhood. At that time, I remember one of the lead workers, her name was Erica Chambers, but we had two young ladies before Erica who started with Metro Hospital and Case Western Reserve that actually help us to understand how to provide a healthy eating, better lifestyle for the residents in that footprint. So we built from that to create healthy eating and active living. And what we did was working with both of these organizations, we went out in the footprint of that area, went to all the restaurants in all those areas and delis and delis, restaurant, gas stations, and also corner stores. We went and assessed the food that they sold to the communities, and then we created a menu of all the restaurants in that community of our footprint to say what restaurants sell healthy, sell some sort of healthy food in the restaurant, and these are the foods that you can select to go in and eat for a healthy meal or a healthy sandwich. So we broke that down. I could not find the menu that we created because I still have that. And we broke it down in a way that anytime any resident went to those facilities, they knew the option of buying the healthy food in that restaurant or that deli, et cetera, per se. So at least they had an idea of choosing what they want to eat healthy or not.
Right.
And that was incredible for us to do that in that time frame, working with Metro Hospital and Case Western Reserve, because they did all the data. And then we prevailed from that. And then also what we did, we additionally created a exercise program. I cannot, forgive me, my East Tech friend, I cannot remember her name. Shame on that. But however, she was the exercise teacher, and she created an exercise program in the footprint so everyone was able to come to Zelma George Rec Center and do the exercise class. Not only the exercise class, we also created a footprint to go out and walk around the footprint of our area, as in Woodhill, Buckeye, Launchmere, coming back around the circle of Rice Library, and those markers are still there for like a 3-mile walk. So we pinpointed that, and then we also implemented and got a grant and set up 3 different areas on the outside with exercise equipment. One is at Fair Hill Partners, one is at neighborhood, at East End Neighborhood, and the other one is, I'm sorry, I forget what the other one is, in our footprint. So you can actually go outside instead of going into a gym. Those 6 type of exercise equipment is still set up on the outside where you can go and work out anytime you get ready. So all that was implemented in the footprint of that area so you can have that relaxing choice to enjoy and then to measure how you want to stay healthy. So that's your option that I agree with the colleagues who assessed what they said, how we have to understand to choose and select our lifestyles on how to become healthy. So it's a milestone to not tell somebody what they should or should not eat per se, but you do have to look at your life and choose a healthier way of eating and maintaining your lifestyle. So I just wanted to put that plug into my colleagues, to the group of people who still recreated Neighborhood Up, and they doing it now in the same footprint. So I want to shout out to Marilyn Burns, Julian Kahn, Tony Johnson. They recreated Neighborhood Up to, to continue this program within the footprint. So after this is over, I'm going to give you those numbers so they can connect with you, because we did this between 2009 and 2019, and that's when I had to step out of the Neighborhood Up program as I ran for this council seat. But I still engage with the group of my neighbors and with this program when they still having meetings. So I want to say that I do commend what you guys doing. So our Black community and other communities, but since you said Ward 4, Ward 7, Ward 5 are the most highest areas that you have dealt with and you did your assessment over, this is what we had done during that time, and they still giving out the best information that they're able to have. So I want to say, as a lot of different other organizations and people are looking at that and trying to help our community to live a healthy lifestyle, which is healthy eating and active living. But I also want to continue to say is this, chair to the committee, as I also myself created a cooking class at Zelma George, and we have a young cooking chef. The first cooking chef came out of Cleveland, I think Central State connected with the Summer Sprout program. They have that Central State. You can go to Central State and go through their extension program. I created a cooking class 8 years ago at Zama George, and it was a young lady. Her name was Stacy, and she has her own farm. And we found her. We created that program for adolescents, young teens, and seniors. So we had that cooking class at Zama George 3 days a week. And so she transitioned out due to COVID. But now we got a young chef that comes in and teach our community how to go and get fresh food and or get the food out of your cabinet and learn how to just prepare the food at home and understand how you can stay healthy with what you have at home. So I am so proud that cooking class is still in progress at Zama George, so anyone in that community can go and join and learn how to eat healthy at any time they want to, and how to select certain foods that they can prepare healthy as well. So I just got a little bit more to say, Chair.
All right.
So I'm gonna bring it back to some of the grocery stores that's in our footprint. We had surveys and studies in those grocery stores, and we had the community, we had the residents coming to the store, so they can tell the owner and the managers what type of food they want to buy in the store and what type of food they should buy for that geographical area. So whoever brought the point to, when you're in a geographical area, those supermarkets actually go out prior to coming in and assess what foods those geographical areas will buy. And if you go to the Far East, you go to the Far West, because we were right there with them, you find certain foods in those other supermarkets that you don't find in the Black community.
Correct.
Which are not healthy.
Correct.
Which are not healthy. They just automatically believe that a pig feet should be sold at this particular grocery store in the Black community, but you don't see pig feet way out there on the west or way out on the east side. They do buy them because they go down to the market and buy them.
Yes.
They go down to the market to buy them. Every culture eats some type of pig feet. They do. But they go down to the market and buy fresh pig feet. They don't buy the pig feet in the
Pickle in the jar.
in the store.
Yeah.
They go to the market because you got market fresh food.
Yeah.
I have learned that doing the assessment when I was part of Neighborhood Up, because we walked with Metro and Case and did the whole data assessment all around the city of Cleveland. They educated us to understand how we can eat healthy, and also showed us how they automatically put certain foods in the Black community because that's what they believe that the Black community will eat, because that's a profit gain. That's a death gain, and that keeps the hospital's pockets full.
Yes, ma'am.
So let's keep it real here. Okay, we're old enough to understand that, but we don't want to speak it because it's real. And it's okay to be transparent.
Yes, ma'am.
But you got to understand, you can go to your supermarket and say, I want this in this market. I want you to go get this in this market. And they supposed to do so because you're patronizing them. They're not patronizing you. They are belittling you and redlining our Black communities to have certain foods so we can have these high rates of high blood pressure and hypertension, because I live it. See, when we were little, our grandparents and our mothers, we ate healthy greens and cornbreads. All that stuff was healthy because they knew how to cook it healthy. That's why we still living today. But however, when we went on our own, we lived a different lifestyle. We got away from healthy, how we was raised on soul food. That soul food was healthy. and good. But then we got away from it and started buying our foods in a different way and became unhealthy. So in our DNA, you can get blood pressure just from your DNA of your historical parents. You don't have to get it per se from the foods you eat. I'm a living contestant of that. I was tagged with my blood pressure at the age of 36. And I was like, I'm only 36. How did I get here? They say it's from your DNA. It's not basically what you were eating. It's just from your DNA. So understand this. I've been on blood pressure pills since I was 36, and I'm a seasoned 60s. I'm a seasoned 60s. Don't say nothing. Chair. Don't say a word.
You know I love you.
I know I love you too. So I understand. So I understand my sodium intake. Because when I go to the doctor, I get tested. I get my blood tested every 6 months. And I have everything tested. My heart, my sodium, my thyroid, my liver, my kidney. Anything I want tested with my blood, I get everything down the list. And when it comes back, my sodium is a little bit high.
Higher.
So when you say, I'm telling you something, when I eat too much sodium, I feel it. My head is heavy. My head beats like a little heartbeat. And I know that I got too much sodium because I buy fresh food I go to Whole Foods, and if I go to any other store, I buy everything fresh. I was taught that when I end up having a thyroid problem, and I do have insomnia. So you are taught when your organs or when your health start changing, the doctors, if you have a good doctor, a good primary doctor who you can actually talk to, regardless of the race, and they get you, they tell you, this is the lifestyle you need to change, because if not, you won't have one, to be brutally honest. So everything that I contain is healthy. I read the ingredients on everything I buy because of that sodium can affect my blood pressure. And when I feel it, there's nothing I can do. You just have to let it pass through. You have to drink as much water as you possibly can to flush it out, because there's nothing else you can do. So I'm just saying that what you're saying is all true, but I do agree with my colleague, well, I agree with all my colleagues, but I also agree with Councilwoman House when she said that people do have a choice of what they want to eat, how they want to eat. You know, when you know that you're healthy, you're going to eat everything in the world. But when you get to that blood pressure or that high cholesterol or that sodium, all of a sudden you're going to change your lifestyle. But then you're on medication. And that medication, it keeps you balanced. You cannot say, well, I feel good, I'm going to stop taking it. No, that medication keeps you balanced, because you start taking it, you're off balance because it's in your bloodstream. Right. But your weight, exercise, understanding how you can eat. Yes, I cheat too sometimes because I'm just not going to stop certain things I love. But however, I eat healthy because what I personally understand and what you guys have brought to this table is true. So closing out on everything, just to say that, let me see what I have. We have to look at what our stores, our supermarket, and everything that we have in the Black community defers us to not be healthy. And a lot of people are in the mindset of a lifestyle, if this is what I got, this is what I'm going to buy. And educating our people in sessions for them just to have a knowledge of the awareness of how you want to live your lifestyle. Yes, ma'am. But remember that back in the day that we was raised by our grandmas and our mothers, our soul food was healthy. It did not kill us because we still here today. It's what we eventually become habit forming, and we bring that in our lives because we become habit forming eating things that we get comfort, like comfort food. And we get a habit of doing that. And then when it comes down to it, yes, sometimes it's too late and sometimes you can catch it on time. But I have great primary care doctors. So when I have my blood taken, they check for everything, every organ in my body. I ask them to test. And when I get that report back, that's sodium. I have hypertension than blood pressure. But however, if I eat a little bit more too much sodium because I have that, that's what tipped me off, because I take my pills every day. Every day. I don't care how much you weigh. I don't care if you're overweight. All that stuff doesn't matter. You can just, listen, at any age, when I was tagged at 36, I was floored. It took me a long time to adjust to me taking blood pressure pills at 36, and I had to watch what I eat. It took me a long time to adjust to that, but that's the lifestyle that I live to be normal. I understand you got to stay away from stress. You got to stay away from tension. You got to stay away from drama, baggage. That all incurs with your health. So I'm just saying that ending it is that it's just that we have to do a lot of stuff personally to take care of ourselves. But and one more thing, like I said, we created that menu. We have exercise equipment all around in the footprint, and we still have our walkway in the footprint of everything. So we actually went out and we have meetings, and a lot of people still work on the outside with those equipments that we implemented all around in our footprint. And I am so proud. Every time I walk around in a footprint in my area and see those exercise equipment outside, you can just walk up and work out. Okay, those menus, we had them in all restaurants, but it's been so long ago they don't have them. But I still have them at home in my bag, and I bring them to my community meetings sometimes and talk about it sometimes with the residents that come to my community now. So it's a lot of time and education. You have to manage your time, and we got to educate it on what's best for you. What's best for you. But I had a lot of good people in my life that also took me to the Whole Food store, a doctor and a gastroenteritis doctor. It was a holistic doctor and a gastroenteritis doctor from Cleveland Clinic. Took me to the Whole Food store and taught me how to reshop, to understand how to eat better, how to maintain my pressure, how to keep my insomnia low, because that affects your everything in your life too. So I'm saying that you need good people that's sincere, that you can hear, you plant a seed and you continue to make it grow. So to say all what you guys are doing is fantastic, but however, we have to, people are going to be people. They form a habit. They're not going to change overnight. But just to give these the options, to know what can be done to take care of yourself, that is the most important. That's the most important thing that you can provide. That you can provide to everybody, so they can understand is your life matters. So thank you for being here.
Thank you.
Thank you, Councilwoman Gray, for your in-depth, detailed response regarding this presentation. I would definitely wrap us up real quick, colleagues. One thing I would definitely say is, as I listen to this presentation, as I talk to my colleagues and all of their speakers who have came today before us, we got to talk about the reality. The government have done things intentionally, like Councilwoman House Jones said. Government has ignored the resources that are needed in certain neighborhoods. So when you look at some of our neighborhoods in the city of Cleveland, we don't have grocery stores. We don't have good restaurants with different options. All you have is fast food option. We have residents who are buying food and groceries for their family from a gas station. Yes. There's nothing healthy about a gas station food. Right. If you're going to the gas station to get something late night, you know what you're putting into your body. So we can't not fault anyone or penalize people for not knowing. So one of the things that I'm listening to and understanding is, and I looked at a research from Case Western Reserve, is that In the city of Cleveland, 50% of children live in poverty, 52% of the population is African American, and 61% of those adults are overweight or obese. Obesity affects far more than a child's clothing size. Overweight children are at an increased risk of developing high blood cholesterol, high blood pressure, and type 2 diabetes. We know this is happening in our city. We know this is happening in our neighborhoods, and we as the government entity have to do our role, like Councilwoman House Jones said, as well as Councilwoman Gray, as well as Councilman Chairperson Kevin Conwell and myself. So I'm definitely looking forward to possibly co-sponsoring some type of legislation for us to take it through our process. I know we mentioned the county. Sometimes we got to do what's right. We're the largest city in the Cuyahoga County. And until we start acting like we're the largest city and start moving that way, things are going to continue to be a problem in the city of Cleveland because we are a part of the neighborhood. So I am urge us as colleagues to do our research, get in front of those business owners who's going to cry wolf first before they understand the reality. You should not be giving people stuff that's going to potentially affect their health. Give them that option of healthier choices, and then also let them be able to say, I want the fries instead. Those type of things are something we need to do. We cannot fault our people for not having the education or the understanding, or do not understand the fact that we lose more hospitals in our neighborhood and city of Cleveland more than we gain hospitals. So therefore, we're not going to get those checkups. We're not getting everything that we need. But since we're educated on this body, we need to do what's right and help educate our residents. So I'm going to just really wrap up because I believe we did cover up so much within this hour and a half. I want to definitely give shout outs to our chairperson, Councilman Kevin Conwell, for the last year and a half. Myself and him have been meeting with Ms. Ashley Herbert. So that is something real great. It's always great when Julie make that call and say, hey, Councilman, we need some support on this. And I do. I wholeheartedly support this initiative, and I do hope that my colleagues see what we're actually trying to do, and whether it affects your neighborhood or not, just think about the options and choices some neighborhoods have and then some doesn't. So we do have to do our part. We do have to understand. And yes, I'm 35 years old, Councilwoman Gray, so I've been going to the hospital, checking with my doctor as well, getting those different updates, also thinking about from the prostate, colon, and getting all that stuff taken care of. We need to do a better job with making sure that our residents are getting the education and getting the resources that they need. So I do support this initiative. I want to thank y'all for coming out. I know that after this, we're going to possibly have some more dialogue. I'm definitely looking forward to sponsoring some type of legislation around this sodium, and we have to do our part as the leaders of the city of Cleveland. Anybody else? All right. Thank you to Health and Human Services, and the Arts Committee is adjourned.